The two-year study on a potential HIV vaccine scenario analyzed data on the disease in Uganda and the effect a vaccine could have.
Data taken from the serobehavioral survey in Uganda, for instance, but we were also using data that was provided from the DHS.
It reveals that an HIV vaccine given to Ugandan adults would reduce the number of infections, even if vaccine levels are relatively low and other programs for treatment and prevention are scaled up. This study shows that a vaccine that prevents 30 out of every 100 people in a vaccine trial could protect at least 300,000 people from HIV between 2016 to 2050, if given to 20% of Uganda's population. Besides, a vaccine that provides protection to at least 50 out of every 100 people in a trial will save 800,000 lives from the deadly virus if given to 30% of the population. A vaccine which saves at least 70 out of every 100 people, if given to 40% of the population, will save as many as 1.2 million people. However, the model shows without the vaccine, even with increased treatment for those who need antiretroviral therapy, at least 2 million new infections will occur in Uganda in 34 years. This will be in addition to the estimated 1 million people already living with the virus.
Even when you have these other strategies being scaled up, the number of new infections will be at such a level that the government will not be able to actually maintain treatment.
Kenya and Brazil have drawn up similar models for governments to plan for a vaccine, which once discovered will be the primary new HIV prevention technique. China is taking a similar direction.
And we're trying to see if we can build in Uganda that kind of framework where we know exactly how we can go forward if we find something works.
However, the search for an effective HIV vaccine has still eluded scientists. An HIV vaccine trial in Thailand, which provided promising results of a candidate vaccine, could reduce HIV in 30 out of every 100 people. But scientists are still debating whether this vaccine can be embraced by all. Therefore, support for the search of an HIV vaccine should be prioritized world over, since a vaccine promises to provide a larger impact on the epidemic. Leah Wanika, NTV Tonight.